Again, this is a short lecture, chapter 37. The only thing I'm touching on in chapter 36 is active and passive immunity, which I'm going to give you what you need on there because the immunizations will be done at later classes. This is the only objective, so you look on your list for this unit, compare and contrast active and passive immunity, prioritize appropriate nursing interventions to use during the treatment of patients receiving anti-cancer drugs. So active immunity is activated by a pathogen. So a bacterium or virus invades the body recognizes it as foreign, starts the antibody or immunoglobulins are released to fight against it, to try to get rid of this foreign substance. First exposure to this foreign substance or pathogen, the immune response is relatively slow. You have signs and symptoms of the disease, but the immune system retains a memory of this, so the next time it invades the body, the immune response comes in. This is called a natural immunity that may be present for the rest of the individual's life. Also, an active immunity is called an acquired immunity. It occurs from exposure to an antigen or from passive injection of immunoglobulin, which is a type of vaccination. Involves administration of a small amount of the antigen, which, although capable of stimulating immune response, does not typically produce the disease. Some vaccines are attenuated, which is a live, weak microorganism. The toxoids are inactivated, and the harmful disease-causing substance produced by, that's the harmful part, is inactivated. But when injected, the body forms the immune response and you develop an immunity. Whereas passive immunity, receive antibodies from another source. The most common one is an infant is born with passive immunity from being passed through the placenta from the mother. This is a temporary immunity or transient. It doesn't last more than a few weeks to months, and sometimes it's important to give this time for exposure development immunizations. So all I need you to know there. Now, nursing interventions, precautions. I wrote this so you can kind of see where you need to be. In chapter 37, anti-cancer drugs exert adverse reactions on rapidly growing normal cells, such as the hair and the skin. It can affect the GI tract, all the mucous membranes, the bone marrow, the reproductive system. Majority of chemotherapy or anti-cancer therapies are now done as outpatients or even within the home. RNs get special training to be a cancer or chemotherapy nurse. So there are measures the nurse needs to take to reduce their exposure to these chemotherapy drugs because they're very hazardous. So listed on page 507, just using disposable powder-free gloves, wearing a gown. If there's a potential for aerosol exposure, to wear a surgical mask, face shield. Changing gloves after administration or if they become contaminated. Cytotoxic drugs, those are ones that kill cells, can be absorbed by inhalation, contact with the skin or mucous membranes. So chemotherapy needs to be in a separate work area, washing your hands frequently, avoiding hand to mouth, hand to eye, but wearing gloves when disposing body fluids of anyone that's had chemotherapy within the last 48 hours. That's simple. Now the nursing process. First, on page 508, Table 37.2 goes over the general things that happen with majority of anti-cancer drugs. That is the place to look, because first it talks about bone marrow suppression. So low RBC, or red blood cell count. What are you looking for? So you're looking, think of your hemoglobin and your red blood cell carrying your oxygen. So anything that decreases your oxygen carrying capacity will result in fatigue, shortness of breath, low blood pressure. Your heart rate will be increased because your body is compensating for the decrease of oxygen carrying capacity. So your body increases the heart rate to try to pump that oxygen and blood around to compensate. So you can look for cyanosis because of the breathing and lack of oxygen transfer. You're looking for mental status changes. On low WBC, or low white blood count, which is called neutropenia, which leaves them very susceptible to infection. They should avoid visitors with any kind of colds or infections. They should report a temperature that reaches 101. Normally that would not be reportable, but for this person it would be because they're at risk. Any kind of fever, chills, upper respiratory infection. Neutrophils, which I said neutropenia, are the primary white blood cells. Avoid medications. This is important. Avoid medications that may mask temperature, such as like taking ibuprofen or Tylenol, because you need to get early signs of infection. With the immune system suppressed because of chemotherapy, the body will not have the acute active response. So that's why little signs are significant. Assess for any localized infections, lung infections, monitor the white blood cell count. Low platelet count is called thrombocytopenia. A platelet count is part of your CBC, or complete blood count. So you're looking for petechiae, bruising, bleeding of gums, nosebleeds, things that are saying that your platelet or clotting factors are low. So read through that one, looking for occult blood. Occult blood is not visible. So you can do a urine dipstick. When blood is not visible, it'll show you that there are red blood cells in the urine. You can do a hemoccult for the feces and emesis, or you can have them report if they are dark, tarry, or especially bright blood. Avoid invasive procedures. Apply pressure on injection sites. GI disturbances, anorexia, small frequent meals, plan rest periods, deal with the pain to encourage appetite. Hard candy, ice chips like lemon drops can help with dry mouth and bitter taste in the mouth. Nausea and vomiting, watching for electrolyte imbalance due to this vomiting. Giving antiemetics before, during, and after chemotherapy. Minimize odors and stimulation, frequent mouth care. Diarrhea, depends on what type of diarrhea it is. You're assessing for bowel sounds, watching again for electrolyte balances. What are electrolyte balances? You're looking at your basic metabolic panel, BMP, sodium, potassium, chloride, calcium, CO2, which is your bicarb. Avoid very hot or very cold foods. Limit spicy things. Limit fatty foods, salty foods. Limit fiber, because fiber encourages bowel movements, and there's lots of fiber in fresh fruits and vegetables, so they have to be careful with those. Mucositis is stomatitis that's in the mouth or mucosa, gets very sore. Assess for how severe it is and needs appropriate treatment management, especially for overgrowth of candidus. And then on the bottom it mentions alopecia, which is hair loss, which affects the entire body. And of course, fatigue, sleep disturbances, emotional distress, depression, pain, and then infertility. So that is an excellent page to look at. I covered the key things that you should look at. So you don't have to memorize the whole thing. I covered the keys. Then moving on, your nursing process. They have a nursing process on page 611 on the cyclophosphamide. Do I want you to know the whole thing? No. But notice on alert 37.1, just to your left, that there is an herbal alert with this. You should be familiar with that. Look over your nursing process. Again, you're looking for those lightning bolts. There are several in nursing interventions and patient teaching. The next nursing process on page 515 is on fluorosil. Again, right next to it, 37.2 is an herbal alert. As you flip the page over to page 517, you will see a couple of lightning bolts on nursing interventions and patient teaching. They are no different really than what we looked at, but there's just some key things that might be added, like this photosensitivity and what are you going to do for that patient. The nursing process on page 520 for doxorubicin again has some lightning bolts, not very many, a couple of them under nursing interventions, patient teaching. All of this really has been covered in that other section. So I don't need you to memorize them specific for the drug, just to see that there's anything maybe different from that previous page that covered the overall in the beginning of the chapter, table 37.2. Again, on this last one, this doxorubicin, on the page prior, on page 518, there is an alert, an herbal alert 37.3 related to this drug. And last one, page nursing process, vincristine. Actually, I've actually heard of that one. It's fairly common, page 523. There's just a couple of lightning bolts there on nursing interventions. A big key here is the peripheral neuropathy and respiratory distress. Patient teaching, there's a couple of lightning bolts, and I don't think it's anything different than some of the others. Oh, here we go. Teach patients signs of stocking glove syndrome, which is numbness, tingling of hands and feet. This may last as long as a year or may never completely resolve. And you see, yeah, a neurotoxicity, so that's specific for this vincristine, and that might be something to keep in mind. I have a funny feeling that might be a kind of NCLEX type of thing. And also on vincristine in chart 37.4 on page 526, you will see a huge on contraindications, fatal if given intrathecally. Intrathecally is into the spine. So anything like that, especially a bowl that says fatal, please note that. And that is all I need you to know out of this chapter. Here I just did a funny for finishing off the second unit. No, I said chemotherapy, not chemotherapy. I thought that was kind of cute to try to put humor into a difficult subject. Okay, and that is the end of chapter 37's lecture and the end of this unit.